everybody to this HCE lesson of health insurance for people 65 plus. We will be recording this session this afternoon so that if you would like or need to go back and get some more information that you may miss today, it will eventually be available, and we would be happy to send that link out to you. Before we get started, I would like to let you know that we're only going to be presenting facts on your options under the new healthcare law. We can't really discuss predictions or outcomes or some non-factual information that aren't yet known about how the new healthcare law may or may not affect people and businesses. And we can't provide you with advice, individual advice about your health insurance choices. What we are here to do is to provide you with education and the resources that will help you to make a fully informed healthcare decision. I'm Pam Atkinson. I am the Consumer Economics Educator for Livingston, McLean, and Woodford counties. Joining me today is Sasha Gravenstetter, who is running the technical side of things. Sasha, do you want to say hello?
Hello, everyone. I hope you're having an awesome day.
It's a beautiful day outside, and we thank you for coming inside and attending our lesson today. If you have any questions or if you need some technical assistance, Sasha's here to help you with that. You can type things into the conversation box to the left of your screen, or Sasha has posted her office number in case you're having some other technical issues that you would like to get her help with. So, Sasha? Here's hoping that we don't have to use you too much today, that we don't have many technical difficulties. So did you know that Medicare is the largest single payer of insurance? In the United States, more than 40 million Medicare beneficiaries equal about 16% of the United States population. In Illinois, that's almost 2 million, or about 14.1% of the population. And when we're talking about budgets, Medicare is a critical part of policy discussions related to the federal budget. Medicare makes up about 12% of annual federal spending. Medicare is the second largest type of insurance, with employer-based insurance, one that you would get through your job, as being the largest. So let's take a look at what we're going to cover today. We're going to look at some of the changes to Medicare that are based on the Affordable Care Act. We are going to take a look at the basics of Medicare for those that are approaching 65. And then we're going to discuss overall strategies for choosing the right plans based on your needs and your income. You do have a choice through Medicare to change some of your options every year, and we'll discuss about the open enrollment period, and then this way you will have time to look at all of your policies and all of your options and make that informed choice when open enrollment comes around again. So let's take a quick overview at some of the changes that were put in by the Affordable Care Act. We've got some free preventive services now. We all love free. We're going to phase out that donut hole. That will hopefully result in cheaper prescription drugs. There's going to be better coordinated health care by providers. And there'll be increased cost for some higher income Medicare Part B enrollees. And we'll discuss who's going to be affected by that in just a few minutes. Some of these changes increase Medicare spending to improve benefits and coverage. Other provisions are going to reduce the growth in Medicare spending to help the program operate more efficiently and help fund coverage expansions to the uninsured as part of the underlying health reform legislation. Hopefully, what this means for you is you will get better health coverage and at a more stable or less expensive cost to you out of pocket. Free preventative health care services. These are going to include things like your vaccines, so your annual flu shots, your pneumonia shots, maybe hepatitis B. You can go to your doctor, you can get those with no copays. No copay for the doctor visit and no copay for the vaccine itself. This would include some cancer screenings and other health screenings. Your yearly wellness visits, so at least once a year you will have a wellness or a check-in visit with your physician, and your welcome to Medicare visit with your doctor, which is the first thing they encourage you to do once you sign up for Medicare. So free means, again, no out-of-pocket costs whatsoever, no copay, no payments towards deductible, and no coinsurance. The shingles vaccine right now is not included in the free vaccines under the provision of the new Health Care Act. And when we're looking at cancer screenings, we're looking at breast cancer, so mammograms, cervical and vaginal cancer, so Pap test and pelvic exam, colorectal cancer, and prostate cancer. So those are the big ones that are being covered now at no additional charge under the Act. Other examples of free healthcare services: if you'd like to quit smoking, there'll be counseling for that. If you have some misuse issues with alcohol, you can get into some counseling. Diabetes and obesity screening and self-management training is included. But also, we'd be looking at bone mass measurement, which helps detect osteoporosis, glaucoma screenings, HIV and other sexually transmitted infection screenings, and medical nutritional therapy by a registered dietitian for diabetes and end-stage renal disease, and possibly some other conditions they're referred to by your physician. Here's the donut hole. So if you're not familiar with the donut hole, it is a gap in coverage when we're talking about prescription drugs. So at the beginning of the year, or January 1st, you would start paying your portion of your drugs until you reach a certain dollar limit. Then there's this coverage gap, the donut hole, where there is little or no coverage. You would have to pay all of it out of pocket. And when you reach a certain dollar amount, then it kicks in what they would call catastrophic coverage, and then your out-of-pocket costs are lowered. What the ACA is doing, the Affordable Care Act, they are working to completely eliminate the donut hole by 2020. So they're going to phase out that Medicare Part D, which is the drug plan, over the next few years. It will be eliminated by 2020. And because of the graduated reduction in the donut hole, it's actually going to be easier to get out of that donut hole before 2020. So here are the remaining years on the phase-out plan. So for this year, you'll pay 45% of the cost for a name brand drug when you're in the donut hole, or you'll pay 58% for generic drugs in that coverage gap. And when we get to 2020, you're looking at 25% and 25%. Quite a cost saving. So in the long run, ending the donut hole will make more drugs more affordable longer throughout the year. So let's talk about the basics of Medicare. For those of you that aren't already in Medicare or are looking to enroll, it's really important to understand the different sections of it in order to understand what it is that you need or may want to purchase as additional coverage. Medicare is for people 65 and older, for people under 65 with certain disabilities, or people of any age that have end-stage renal disease, which is permanent kidney failure that requires dialysis or a kidney transplant. Medicare has 4 major parts: A, B, C, and D, plus supplemental coverage. And the parts of Medicare we're going to define in the next few slides. So when must you enroll in Medicare? It's really important that you take a note of this. You must enroll during your initial period, and that is 3 months before the month you turn 65, the month you turn 65, and the 3 months following the month you turn 65, for a total of 7 months. Even if you're still working and have employer-provided health insurance, you must enroll in Medicare. The penalty if you don't, approximately 1% for every month you did not enroll in time in Medicare of an increased premium for the remainder of your life. So this can be a really costly error. Most employers who have people that are working past the age of 65 and provide employer-provided health insurance will also require that you do enroll in Medicare and then switch you to some kind of a supplemental policy instead of the full policy that they are on. But you should check with your Human Resources Department to make sure of that. Here are some important dates to remember for this year. Annual open enrollment for Medicare, the time that you can enroll or make changes in your additional policies on an annual basis. This year begins on October 15th and runs through December 7th, and all policy changes would take effect then January 1st. Annual open enrollment for the marketplace policies under the Affordable Care Act. These would be policies that are not Medicare, that you might have some tax subsidies available to you, and you might need to know about these if you have other dependents in your house that are under 65. Annual open enrollment for marketplace is November 1st through January 31st, 2017. So it's a little different open period there. But keep this in mind. If you need to have coverage to start by January 1st, you have until December 15th of 2016 to get that policy in force. Now, employer-provided health insurance may have different dates. For example, we're currently in our open enrollment period here at the University of Illinois Extension. So you would want to check with your Human Resources Department for your particular open enrollment period if you have employer-provided insurance. Okay, let's start going through the alphabet. The basics of Medicare. Medicare Part A. This is what they call hospital insurance, or it's the original part of Medicare. It helps to cover inpatient, skilled nursing care, hospice care, and home health care. And there's different restrictions and qualifications on each of these different levels of care. Generally is an 80-20 split. Now, this particular coverage comes to you free of charge. What that means is you don't have to pay a monthly premium for Medicare Part A. In fact, this is what you've been paying all along, is the premium. You've been prepaying your Medicare premium. That's what the FICA deduction is on your paychecks. If you have a Medicare Advantage or what is called a Part C plan, then that will automatically cover Part A, and we'll talk about the mechanics of that. But initial or basic Medicare is Part A. It covers hospitalization and other related types of care. It does not cover doctor visits and other things. That would be Medicare Part B. This is the medical insurance part of Medicare. It is part of original Medicare. They have split them apart. This one helps cover doctors, other healthcare provider services, outpatient care, medical equipment, home health care. Now, what you do is you're going to pay a standard premium every month, generally out of your Social Security check. If you are 65 and enrolled in Medicare, but have not yet triggered in your payments under Social Security, you will be billed and have to pay this premium directly. And the premium tends to stay pretty standard unless you have a high income, and we'll talk about higher income premiums in just a few moments. Medically necessary services, we would describe that as being services or supplies that are needed to diagnose or treat your medical condition that meet accepted standards of medical practice. This would include clinic visit, outpatient services, and home health care practices or services. And then preventative services, health care such as the flu, or to detect it at an early age when treatment is most likely to work best, although some of your preventative or most of your preventative treatments are now being covered for free under the Affordable Care Act. But that's what is part of Medicare Part B. That would be the doctor's visits. Part A is the hospital. So let's take a little look at Medicare Part C. This is a little bit tricky. It's called a Medicare Advantage Plan and actually combines parts of existing Medicare but gives you the added benefits of some others. Medicare Advantage, sometimes called an MA plan, already covers Part A and Part B of Medicare. And then there's other options that you can choose to include in your Medicare Advantage plan. These options might include your prescription drugs, or what would be Medicare Part D. It might include vision insurance or dental insurance or other wellness things that aren't even covered by Medicare. Medicare Part C, or Medicare Advantage, is a private insurance plan. So you would purchase the whole plan, the whole Medicare Advantage plan or coverage from a private insurer. For example, like Blue Cross and Blue Shield or Coventry or Health Alliance. They all carry, as well as many others, basic Medicare Part C plans. Now Medicare then helps pay some of the cost of this policy. So they would kick in the Part A, Medicare Part A premiums, that the coverage that you wouldn't pay for under traditional Medicare, they would contribute that. You would pay the rest, and the amount varies depending on the type of plan you purchase. One thing you need to know is that all plans, all Medicare Part C or Medicare Advantage plans, have to follow rules that are set by Medicare. Part D is your prescription drug coverage, sometimes called PDP. Part D is optional with Medicare. Many of your Medicare Advantage plans include prescription drug coverage. And of course, this helps cover the costs only of prescription drugs. Now, Part D is purchased separately from Part A and Part B. So Part A is hospitalization, Part B are your doctor visits and other services, Part D is your drugs. You will pay a monthly premium plus other costs like copays. And again, Medicare Part C plans also cover Part D coverage. And private plans also have to follow Medicare and Medicare rules. Now there's another type of supplemental policy called Medigap. It's a supplement, and it is meant to help you fill in the gaps between what your Medicare insurance pays for and what comes out of your pocket. So you would purchase one to help lower your out-of-pocket spending. So Medicare Part A or your hospitalization, generally an 80-20, so your Medigap policy would help or completely pay that 20%. Your Part B might often have copays or deductibles. Your Medigap coverage might include all or most of that coverage right there. This is in addition to your Part B premium costs. So this is, again, a separate policy that you would purchase. You must have Medicare Part A and Part B in order to purchase a Medigap policy. If you have a Medicare Part C or a Medicare Advantage plan, you are not eligible for Medigap because it already covers a lot of what the Medigap policy would cover as far as dollar amount. Also keep in mind that a Medigap policy only covers one person. So if you and your spouse both want Medigap coverage, you will each have to buy separate policies. You'll pay the private insurance company a monthly premium for your Medigap policy in addition to the monthly Part B premium that you pay to Medicare. Now you can buy a Medigap policy from any insurance company that is licensed in your state to sell one. Be sure to compare plans and prices before you buy. If you have a Medicare Advantage plan, you can apply for a Medigap policy, but you need to make sure that you leave the Medicare Advantage plan before your Medigap policy begins. You cannot have both. Any standardized Medigap policy is guaranteed renewable, even if you have health problems. This means the company cannot cancel your Medigap policy as long as you pay the premiums. Some Medigap policies sold in the past used to cover prescription drugs, but plans that were sold after January 1st, 2006 are not allowed to include the prescription drug coverage. If you want drug coverage, you can join a Medicare prescription drug plan along with your Medigap policy, or to use that Medicare Advantage policy in place of the Part D, the Part A, the Part B, and your Medigap. Be aware that it is illegal for anyone to sell you a Medigap policy if you have a Medicare medical savings account. Medigap policies only help cover costs of Part A and Part B. They do not help pay for prescription drugs. That's Part D. Do not offer benefits like Part C, and they do not cover long-term care, vision, or dental. So a few things you need to know about the difference between a Medigap and Medicare Advantage plans and marketplace plans through the Affordable Care Act. A Medigap plan is not affected by the new health care law. So any of the things that were free or at low or no cost under the Affordable Care Act does not apply to a Medigap policy. Medigap policies are also not available in the health insurance marketplace. And Medicare Advantage or Medicare Part C is designed to work with the Medicare system, and it should not be replaced with a marketplace plan. You want to make sure that you don't overlap or purchase incorrect or incompatible insurance policies to work with Medicare, because you could end up paying multiple deductibles, especially if you try to replace your Part C plan with a marketplace plan. A lot of people think that they can do a marketplace plan in place of a Medicare Advantage. But what they don't understand is that the insurance marketplace helps provide subsidized policies to make them cheaper for people that are having difficulty affording their insurance. Because you're on Medicare, you're already considered to be tapping in to a subsidized medical plan, and that's why Medicare plans are not part of the marketplace, and you are not eligible for marketplace plans and Medicare at the same time. If you are a higher income American, you may have to pay higher Medicare premiums for Part B. This only affects the Part B and the Part D prescription drug coverage. In total, it's going to affect less than 5% of the people with Medicare, and does not affect those with Medicare Advantage plans because they're paying a private insurer for Part A, Part B, and Part D, as well as other options. Based on modified adjusted gross income levels, a couple with an income of $170,000 or $85,000 for an individual or more will pay a higher premium for Medicare. Now, to find out the exact premium increase based on your income, you should go to Medicare.gov, or you can call 1-800-MEDICARE, give them some specifics about your income, and they will be able to more accurately predict how much you might pay for Medicare premium for a higher income. Right now, Part B standard premiums for Part B Medicare is $121.80 a month here in 2016. There's generally what they call a hold harmless provision in Medicare that prevents increases in Part B premiums unless there is a cost of living adjustment or COLA in Social Security payments. However, that does not apply to new enrollees, those on Medicare who pay directly, so you're not yet taking Social Security, or for those who kick in the higher premiums for higher incomes. Now, keep in mind that Social Security cost of living adjustments are announced in October, and an increase in Medicare Part B might follow sometime in October. Since open enrollment begins October 15th, you may want to wait until these amounts are announced before making changes to your medical coverage. But that shouldn't keep you from doing the research now in case you're looking for more savings. So the question is asked frequently, what if I am not eligible or can't afford Medicare? There are some people that have not paid into Medicare through work. So if you're not eligible through work history or spousal eligibility, you can pay for Medicare coverage. You could also buy insurance in the marketplace. And if you're not eligible for Medicare and have medical and financial needs, there's some state programs that combine both Medicare and Medicaid. Again, there's some very specific rules and restrictions on this, and in Illinois, you can get more information at health.illinois.gov, or generally, you can get information for other states at medicare.gov. Illinois, you may have heard, has expanded its Medicaid program to cover households with incomes up to 138% of the federal poverty level, but that's mostly for those under 65 years of age. If you make about $900, for a single person, I believe it's about $973 a month, you would probably be eligible for some assistance on health insurance coverage, even if you are Medicare eligible, at health.illinois.gov. Okay, that takes care of the basics of Medicare and some of the changes under the Affordable Care Act. Now that you have all of this information and you're probably a little dizzy from trying to figure out the Part A, Part B, Part C, Part D, and Medigap policies, now we're going to talk a little bit about how to figure out what kind of policy is best for you, for your needs, and your income. One of the things I would like to let you know is that the University of Illinois Extension has a great web page at web.extension.illinois.edu/ACA for Affordable Care Act. It talks all about the Affordable Care Act and also includes a link to the Smart Choice Health Insurance Workbook. We're going to be looking at a few things out of this workbook today. And I would certainly encourage all of you to go to this link and to pull down whatever worksheets and things that you would want from the Smart Choice booklet in order to help you make your insurance choices. There are other healthcare costs that are not covered really under almost any policy. You need to be able to decide what you want, what you need, and how much you can afford. Like I mentioned before, the University of Illinois Extension has a web page that explains the Affordable Care Act in detail. Um, this address is also going to be at the end of this presentation in case you've missed it. On this site is a link to the University of Maryland Extension and their Smart Choice Health Insurance Workbook. And then the next several slides are going to help you help cover the process by which you can use to make the best choice in health insurance needs. So you may ask, why do I even need health insurance? Why is it important? What do I need? What are my choices? And of course, how much can I afford and how much will it cost? You need to ask these questions whether it's Medicare you're looking for or choosing a employer-provided or insurance or supplemental policy to Medicare. Often, people over 65 need traditional insurance policies if you're taking care of Medicare ineligible people, like a disabled adult, child, or maybe grandchildren. If this is the case, you may want to visit the Get Covered Illinois website, which is the extension page, to find a navigator or somebody that can sit down with you and explain your requirements and options. The remaining portion of this presentation is going to help you decide, based on your usage of the medical community, what kind of policies and coverage you may want based on your needs and your budget. So why health insurance? Well, first of all, it provides peace of mind. You know that you're covered. You know that if you have medical needs, you'll be able to access that without a lot of worry about whether or not you can afford it. It helps protect you and your family's financial future. Did you know that about 62% of all bankruptcies, all personal bankruptcies, are based because of unaffordable health care options? This was done by Harvard University. It is the leading cause of bankruptcy. And one of the interesting parts of this study showed that 78% of bankruptcy filers did have some form of health insurance. And so that kind of busts the myth that medical bills affect only the uninsured. A rare or serious disease or injury can result easily in hundreds of thousands of dollars in medical bills, bills that can quickly wipe out savings and retirement accounts, college education funds, and home equity. Once these have been exhausted, bankruptcy may be the only shelter left, regardless of whether the patient or his family was able to apply health coverage to a portion of that bill or not. And generally, if you have health insurance, you have better health outcomes because you generally will regularly use your healthcare providers, get regular checkups and regular care for anything that may be ailing you. And also, why health insurance? It's now required by the law, and you could face a penalty on your income tax if you don't have coverage for 12 months out of the year. So what do I need and what do I want and what are my choices? Most people don't go to the grocery store without some idea of what they need. You shouldn't go insurance shopping without an idea of how you and your family use medical services and what policies meet your need. Information about your doctors, how often you see them, what procedures or tests you may have upcoming should all be taken into consideration. Are your doctors included, or will you have to change? Can you see any doctor, or is there a certain list of providers? What if you travel or become ill or injured? Will your insurance cover expenses? This is the information that you need to use when you compare policies. This is the My Health Insurance Needs worksheet, and it helps you list out all the providers and how you use them. The last page of this set of worksheets asks you then to prioritize certain aspects of medical usage so you can help analyze the different policies according to your needs. So for example, if you know that you have to see a cardiologist 2 or 3 times a year, you would put that down. So that's a specialist. Does your policy allow you just to go to a specialist, or do you need to have a referral first? Maybe you travel a lot. Maybe you want to know that you would have access to doctors that are in network, or less expensive no matter where you go across the country. Sometimes that's called an open access plan. And so you would want to see if that is included in the policies that you're picking out. The priorities would also include, what's more important to you. Is it that you have your doctors in the health insurance, or are you willing to change? Like I said, if you travel and need people across the country, or if you have easy access to certain types of medical procedures that you might need. All of those you can help figure out by figuring out how often you visit, for example, your family doctors, your specialists, average emergency room visits, and things like that throughout the year. That will help you decide on some basic kinds of policies. The next big question is, how much will it cost and how much can I afford? Well, once you've determined what your medical needs are, it's time to start looking at policies to see what matches your needs and your budget. Policies should all have a chart of their services and your portion of the cost in a document that's called Summary of Benefits and Coverage. Now, it could be in the back of a larger policy booklet, or it could be a separate standalone handout. But this Summary of Benefits and Coverage is required in all policies according to the Affordable Care Act. Here is an example of what a summary of benefits and coverage might look like. So for example, maybe from one particular provider, they have several different, say, Medicare Advantage options. And they might list them side by side here so that you can see exactly what this particular policy in its different forms looks like. So option 1 might be an HMO or health maintenance organization, or one that's called an EPO, which is an exclusive provider option. And that's where you have to use some very specific doctors and don't really have a choice. Option 2 would be a point of sale. That means you can pretty much go wherever you want to doctors that are either in network or out of network. You have free choice. And then preferred provider option, they have definite preferences of who you would see in different categories. And as you can see on this slide here, this document, the sample summary of benefits and coverage, lists things like, do you have a deductible? What is your out-of-pocket maximum or limit for the year? Are there any lifetime limits? Under the Affordable Care Act, lifetime limits now need to be all unlimited. Do you have to have a primary care physician? And then it talks about what you would pay at a specialist office, well baby visits or an adult physical exam, and immunizations covered. It would go through most of the items that you would be checking on when you're comparing insurance. Now, if you have a specific medical issue that's not covered in the summary chart, you may need to go through the larger booklet to find the answer, or to call the insurance company and speak with someone who's familiar with what claims are approved and what might be denied. An example of things that may be denied or covered depending on the insurance policy might be some drug trials or experimental drugs used for cancer treatment, for example. Okay, what you're seeing on the screen now is the My Health Insurance Plan Comparison Worksheet. Again, this is part of the Smart Choice booklet that you can access and print whatever portions you want out of it for your own use. This particular form lets you go through all the very specifics of different health plans. So here you might be choosing between, say, a Blue Cross Blue Shield, a Coventry, or a Health Alliance plan. And you would start with, option 1. What kind of an insurance plan is it? Is it a preferred provider? Is it a health maintenance organization? Is it an exclusive provider service? And then you wouldn't, unless you're going through the marketplace, you really wouldn't go through the bronze, silver, gold, or platinum levels. You would almost consider this to be like an employer related insurance policy if you're going for Medicare. And then there's other questions all the way down. A question, for example, do all my providers, doctors, hospitals, and specialists take this plan? And it goes through an extensive category listing of all the things that you would want to compare to make sure your insurance covers or that you're comfortable with before you make a choice in actually purchasing a plan. You're also going to use the My Health Plan Comparison Worksheet. In addition to comparing the services, it's also going to help you compare your total estimated health care costs to see which plans are truly right for you. So, for example, going through these worksheets, you're going to determine that maybe you see a regular physician twice a year and maybe a couple of specialists twice a year, and maybe you might have an emergency room or a prompt care visit once a year or so. And you can add what all of that adds up to and then check, are these things covered? Do I have a copay? Do I have coinsurance needs? What is that going to cost me out of pocket? And then when you add that to the medical premium for the policy, you can determine what your total out-of-pocket health care cost is. So for people that don't use your health insurance much, it might actually be cheaper for you to get a high deductible plan where you pay more out of pocket before any insurance coverage takes over. But if you're a heavy user of insurance, a PPO or an HMO with low copays for services might be your best option, even though the monthly premium for that would be higher. Unfortunately, until you do the comparisons, you are not going to know what is best. This is also going to help you decide if you want traditional Medicare policies, an Advantage Part C plan, or a Medigap policy. And finally, once you've totaled your yearly estimated healthcare costs between each policy you're considering, take the time to see how this cost will fit into your monthly budget. Divide that amount by 12. Plug that number into the budget. So you've got your annual cost divided by 12, and that would be a monthly health care cost. You may have to adjust spending in other categories to compensate, or if you use less medical care than you've planned, you might have more for savings. A win-win situation for your budget either way. Like I mentioned before, we have a couple of different resources that are available for you. The best one through the University of Illinois Extension is the Get Covered, Stay Covered webpage. Talks all about the Affordable Care Act in Illinois. And it also has that all-important link to the Smart Choice Health Insurance workbook that we've been showing you some of the pages out of. You're going to want to go to that site, download what pages you need, and to start working through them. We also have a blog called Plan Well, Retire Well. This nationally award-winning blog covers all kinds of subjects in all different financial categories. It's actually perfect for anyone of any age, not for people that are yet to retire or those that are already retired. We cover everything from children to college students all the way up through the spectrum. You can access the Plan Well, Retire Well blog at www.retirewell.illinois.edu. So now Sasha is going to open up the microphones, or you can use the chat feature over on the side. Do you have any questions for me? This has been a lesson that has a lot of different parts to it and can be a little overwhelming at first. Okay, if you have any questions, please feel free to jump in or to write them in the chat box. Finally, I would like to ask you to fill out the participant evaluation that hopefully every office has for every participant. That helps us continue to develop new lessons and update existing lessons that will actually meet your needs. For leaders or support staff, unit leaders, please fill out the site coordinator report. This helps us know if there were any issues, any problems, what we can do to help make things better at the site. When you've done all that, you can scan and email the reports to Seisha. Her email is up on the screen, or you can send them by U.S. mail to Seisha at the University of Illinois Extension and her office in Bourbonnais. We certainly would appreciate the evaluations to get to us as soon as possible. We do use that information for a variety of reasons, but including some reporting on how many people we've reached. We do know that the HCE people will frequently you will turn around and then reteach this lesson to others in the community, and so that's a reach that we would like to know about. Any more questions? We'll keep things open for a few more minutes. I'd like to thank you all for coming and joining our presentation today. And we hope to see you again on another HCE lesson given by a consumer economics educator. For Seisha, I'm Pam, and of course Kathy Sweedler is our third consumer economic educator. We thank you for participating and hope you have a terrific rest of your day.